Today I want to talk about an important topic, which is dissolving fillers. This topic is important because what's been happening over the last several years now is that because dermal fillers had gained so much popularity over the years, we're now seeing some of the problems or complications with dermal fillers, and people are coming in seeking for more long-term results, and hence they're asking for surgery. However, before we can even talk about doing surgery or talking about long-term results, the very first step is we have to dissolve the fillers that were there. And that's creating a lot of anxiety in a lot of patients because they're worried that the dissolving process itself is going to somehow ruin their face because there's some misinformation out there. So I wanted to tackle that misinformation head on. So number one, let's talk about the dissolving process. So in order to dissolve dermal fillers, we use an enzyme called hyaluronidase. Hyaluronidase is a naturally occurring enzyme in our own bodies. Why? Because we actually produce hyaluronic acid in our bodies. It exists in our skin, it exists in our joints, it even exists in our eyes. We're constantly producing HA and breaking it down. So by injecting an enzyme into our bodies to dissolve the fillers is not going to disrupt other tissues because that enzyme is specific for hyaluronic acid. So it's not going to destroy our fat, it's not going to destroy our muscles or connective tissues. So it's not going to affect other tissues other than hyaluronic acid. Now, what happens with dermal fillers is that the way that dermal fillers are produced and manufactured, they tend to draw water in, they're hydrophilic, and they cause tissue expansion over time. What we're experiencing now is that when we dissolve the fillers, first of all, we're losing all the volume that we've had from the fillers, but also because of that tissue expansion, now the skin, the connective tissues have stretched out, so then the skin looks more wrinkled, and there's some laxity, some descent of the face that happens because of the two. So we actually look a little bit more aged after we dissolve, and that can be very worrisome. It's all part of the process to treat your face and your skin to regain a more healthy and natural appearance to your face. And it's a necessary thing. So in our practice, what we do is we will dissolve very, very slowly over time, multiple sessions, and we will use energy-based devices such as RF microneedling, CO2 to help tighten the skin after we've dissolved them. And then we'll replace the volume with an alternative to dermal fillers, which in my practice, the best alternative to dermal fillers is your own fat. Why do I like using your own fat? One, because fat is not hydrophilic, meaning it doesn't attract water, so there's no expansion of the fat over time. Number two, the injection of fat in the areas in the under eye actually integrates quite well because there's a new blood supply that develops to those fat cells. So hence, it doesn't shift or move around. As opposed to dermal fillers that can potentially shift or move around to other areas and cause issues like malar edema and swelling of the cheeks. Number three, the results of the fat transfer are much longer lasting because once you've developed a new blood supply to these fat cells, then they become part of your body and then they will age just like the rest of your body. So the results are usually much, much longer lasting. The summary is that dissolving itself, you don't need to be afraid of dissolving as long as you are working with an aesthetic provider who has a good understanding of what's happening from the dermal fillers and from your face and that can address these changes in a way that's comprehensive and that's natural. You'll come to a good result. However, it is a process and it does take time. And so you have to be patient and you have to trust your provider to get you to the place where you need to.